3 years after the World Health Organization declared COVID-19 a pandemic, questions still linger about the origins of the virus that changed the world forever. The virus was first detected in Wuhan, China in late December 2019, quickly linked to the Huanan seafood wholesale market. But as cases grew, health authorities in Wuhan scrubbed the market clean by January 1, 2020, removing critical evidence. Exotic wildlife like raccoon dogs and bamboo rats, believed to be intermediary hosts, were removed from the market. China has refused to give the WHO and other researchers full access to the remaining data, leaving many questions unanswered. Competing narratives have emerged about the virus's origins, from natural spillover to lab leak theories. Evolutionary biology supports a natural outbreak, while others believe it may have accidentally leaked from the Wuhan Institute of Virology. Conspiracy theorists even suggest COVID-19 could be a bioweapon, released by either the US or China. So what do we really know, and what does science suggest might be the origin story of the virus? Scientists and experts appear to lean towards a natural cause, but China's opacity has fueled conspiracy theories. In early February, the US Department of Energy's intelligence agency suggested with low confidence that the virus originated from a lab leak. FBI Director Christopher Wray also assessed that the origins of the pandemic are most likely a potential lab incident in Wuhan. Concerns about Beijing's lack of transparency on COVID-19 origins date back to the start of the crisis. China did not officially declare the virus contagious through human-to-human transmission until January 20, 2020. A study published in the New England Journal of Medicine in March 2020 revealed that Chinese researchers knew about the virus much earlier. Had they disclosed the contagious nature earlier, we might not be in this pandemic at all, experts say. 2 different strains of COVID-19 were discovered early on, suggesting the virus had been circulating long enough to mutate. 3 lab workers from the Wuhan lab reportedly sought medical treatment in November 2020, raising further suspicions. China also punished whistleblowing Dr. Li Wenliang, who first warned about the new virus. In May 2021, prominent scientists called for further study into COVID-19's origins, not dismissing an accidental lab leak. Many scientists now firmly support the natural spillover explanation, especially after 2 major studies in July 2022. One study explained the parallel existence of the 2 early strains of COVID-19, suggesting multiple failed attempts to jump to humans. Another study mapped the residential locations of early patients, finding they were clustered around the Huanan market. Throughout the pandemic, there were multiple cases of the virus transmitting from humans to animals, supporting the zoonotic spillover theory. For many scientists, a zoonotic spillover is the only conclusion that can be made right now. However, some scientists still believe a lab leak remains plausible due to the lack of information from the early days of the virus. Richard Ebright, a molecular biologist, doubts the virus emerged from the market in Wuhan, pointing to high-risk virus enhancement research. For those leaning towards a lab leak, there is no evidence it was anything other than an accident. Experts agree on the need for better safety standards at biolabs and wet markets to prevent future pandemics. Many scientists argue it is vital to keep probing how the virus first reached humans to prepare for future public health crises. The consequences of determining the origin of this pandemic are likely to be geopolitical, affecting China's reputation. We may never know for sure what caused the greatest human crisis of our lifetime,